So for Botox, it's typically used for the upper third of the face, going from forehead down to glabella to the periorbital region. My main thought process when I'm evaluating a patient for these options is going to be overall one, height of the forehead and level of rhytids. People with more dynamic rhytids, you want to evaluate how high they go. Some people will have a shorter forehead. They will have single row, more temporal activity versus not, versus full forehead all up to the hairline with dynamic action. So people who have longer foreheads, you want to think about doing not just your standard single row of injections, but I will actually put them higher up in the hairline to decrease some of that motion up top. For the glabella region, I'm evaluating the level of transverse lines as well as oblique lines, which can be either procerus activity versus corrugator. My typical injection sites are going to be, if you had, like, raise your eyebrow for me. So in her, I would put an injection spot here, 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 out to this temporal crest, right about here, staying well above this brow. People with really heavy lines lower may still have these dynamic lines lower, which could be spot treated with small amounts of Botox and not drop the tail of the brow. And so for her, you can see that she doesn't have a lot of activity sitting up here. So this would be mostly wasted product if you put it up here, when determining how many units you're going to use. Go ahead and scale down for me, like scale here, Ingrid. So here you see she has a pretty strong procerus muscle as well as corrugators. When I'm looking at this, I usually will put an injection either down low to the nasalis for any kind of bunny lines. I put an injection here, deeper in the tissue to treat the procerus. And then for corrugator, I will actually put it, one injection site in this angle right in the head of the corrugator, and then I look for the height. It doesn't typically go in this trajectory. It typically is more flat. So I'll put one here, and then I'll put one right about here. This one I'm angling up and going deep in the heart of the muscle. As the corrugator extends out, it's inserting more superficially into the skin, so I would put it more subdermal right about here to treat that. I use more here than here, of course. There's actually some thought too, the corrugators themselves start 3 millimeters lateral to midline. So you can come in this incision, actually go deep and angle and hit the head of the corrugator, but you don't want to be below this region. Whenever I do my injections, you want to relax. I will mark out these areas, and then I will actually pinch the muscle up, because I'm mainly what I'm doing is I'm occluding that supratrochlear and supraorbital arteries coming out here and preventing myself from going below the brow. So I will basically have my idea where I'm putting it. I stabilize, I come right into the muscle, inject, right below skin, inject, and then let go, and there's typically not a lot of bleeding. Going to here, I will actually kind of pinch up this for distraction techniques and go straight in here and here into that muscle. Around the eyelid, I'll have them smile and look for the rhytids here. Go ahead and smile for me. So you can see that she has some rhytids going all the way vertically as well into the cheek here. So for her, you want to stay a centimeter out from the rim. So my injection spots would be here, here, and right about here. It takes about 10 units per side to fully knock out the orbicularis. Any person with you can relax now. Any person with any brow descent or some mild brow descent, I will put 1 or 2 units right below the tail of the brow, subdermally only, to assist as a modified sort of brow lift procedure, which everyone seems to love, and it doesn't take a whole lot of work. But be careful, because this can bleed. So I'm also evaluating for any kind of vasculature around the eyes, around the forehead, and you can modify your marks accordingly, because that's a surefire way to get a bruise if you don't pay attention to those things. My typical amount of units I'll use for someone I've never treated before is going to be around 15 units total for the corrugator. So I'll put 5 and 2.5, 5, 2.5. Procerus, I'm typically treating between 2.5 and 5 units, depending on how heavy and strong the muscle is. For the forehead, it varies between 10 and 20 units. People with a very short forehead, minimal activity, I'll spread that out across the forehead, versus people with more dynamic, stronger muscles, I'll tend to put more toward the higher end of units. Around the eyes, like I said, it's typically 10 to 15 units to effectively treat both sides, preferably 10 units per side, but that's quite a bit for the first-time user. I typically head toward about 5 to 10 units per side, just to see how much activity they get. And then adjust accordingly during the next injections. But typically, if I'm treating forehead, glabella, and periorbital region, it's around 40 units. If I'm treating just this area, 15 to 20. This whole area, 25 to 35. For platysmal banding, you want to evaluate if you're going to inject them with Botox, central bands, which would be more central, of course, and lateral bands. I will actually have the patient animate and try to activate this muscle for me. So you see she has central bands, but nothing really laterally. So for her, I would dot out where these are, and you want to put 2.5 units or so in each of these marks, about a centimeter across, going down these lines. You relax. Overall, for the neck, it's 30 to 40 units to address both central and lateral bands, just kind of marching down straight into the heart of the muscle, like pinching it up and going right into those areas, or having them animate and going straight into it, a centimeter apart.